name's Esty with the GVU MSAT. This is for my CV patient case. This patient has just been diagnosed with sickle cell trait. He is a freshman on the football team, and for the purposes of this, he'll just be on the Grinnell football team. So, so test results came back. You're positive for sickle cell trait. So good news first, we don't have to pull you from football. We can continue to play football just fine. There's just some precautions and things we got to kind of put in place, and just some things we got to keep our eye out. So first things first, what this means for a football player is that cardiovascularly, we're going to be a little less fit than maybe where we should be if we didn't have this trait. Not a big deal since we're a football player. We're not running a bunch of laps. We're taking breaks in between plays. You're not expected to go run 5 miles as fast as you can. But one thing we do have to be careful with actually implement is making sure we're taking kind of more breaks than maybe we think we should. All this is to kind of reduce risk with this. So it's if you have a workout that's say 10 100-yard sprints, maybe we only do 6 or 8 of those and we take a few reps off, right? That's kind of what that means for you, just to kind of let our body kind of process the oxygen, because we are getting a reduced amount of oxygen with this trait, just kind of catch up, get a little bit of extra recovery we need, and then we can do the reps we need to do. So just a little bit of little bit less work, a little bit longer rest to work ratios. But that's really the only training thing that's going to change for you. And then when games roll up, we'll have to be mindful of how many snaps you're getting. We get to a certain point, we got to pull you out for a few snaps, we can go back in. So, you won't be playing every single snap, but you will still be able to play the majority. We'll just have to take a few extra plays off throughout the game. Complications. So the two big ones we're kind of looking at are kind of things that can come in with altitude and heat. So because of sickling cell, what sickle cell trait does, especially in the heat, is it makes you more prone to dehydration. So first off, we just have to make sure that you're drinking enough fluid, especially in the heat now that it's preseason. So, fluids, get your electrolytes, get your water, and that's things we have educational pamphlets in the locker room that you can look at to kind of know what hydration is, just kind of make sure we're following our guidelines and then maybe doing a little bit more. Altitude, we more than likely will not have to worry about this, but just in case, all what sickle cell trait does is basically makes your oxygen uptake just a little bit less efficient. So when we're up at altitude where the air is thinner, there's less oxygen in the air. Again, we have to back off a little bit, take longer rests than what we do at sea level, even with our modifications, just to make sure we're getting the recovery we need so we don't have any sickling crises issues pop up. So, and I keep kind of mentioning that word sickling crises. I haven't really explained it, but that's what I'm going to do right now. What that essentially is kind of the accumulation of the sickle cell trait, the lack of oxygen, the blood clotting that can kind of happen from our sickle-shaped cells, which is hemoglobin 2, if you're interested, and basically just means instead of the nice round circle hemoglobin, sure you've seen in textbooks or videos, it makes a half moon shape, and essentially less surface area, less oxygen. And those irregular shapes can cause blood clots in the smaller vessels in our body. And so that's why we take those longer rests, so we can kind of clear those things out and let things return to normal and then start working again. So red flags. The big one is really muscle pain. So this is going to feel similar to maybe cramps or super bad fatigue pains, kind of after, think of like a really hard leg day, right? Except the one difference from that is we're not going to have like that muscle tightness that pops in with that. Like cramps, obviously your muscles seize up, everything hurts. Like muscle fatigue, you're just generally tight. With sickling pain, that doesn't happen. It just hurts really bad and you get weak. And that's from like the clotting, the lack of oxygen. Your muscles have nothing to work with, so it hurts and you have no strength. So that's kind of our big red flag. We're also like anything that can kind of appear as like a heat illness. So nausea, feeling dizzy, passing out, things like that, lightheadedness, like those kind of symptoms that we might generally associate with heat. Those are also in our red flag box, where if we start feeling those, we're going to pull out, we'll kind of monitor, see how you're feeling, and then we'll make our like practice or game time decision kind of as we go through that. If things do get bad, we do have our EAP, like we will have ambulance services on site if we need to, like especially during games. However, if we kind of follow our guidelines, like hopefully we won't need those services and we'll just have a successful career. Questions, comments, concerns? All right, cool. You have my email. If anything pops up, shoot me an email and we can talk about a few things, but let's have a good season.